Now, let us hear about measures being undertaken to protect a workforce from COVID-19 from a leader in the private business sector. I am happy to introduce our next speaker, Mr. Paolo Maximo F. Borromeo, who has been a managing director since January 2016 and a member of the Ayala Corporation Management Committee and the Ayala Group Management Committee since September 2014. He has served as Group Head of Corporate Strategy and Development of the company since September 2014. In his role, he oversees the overall corporate planning process, portfolio strategy, group-wide innovation projects, data and analytics, digital initiatives, new business development, and special projects of the Ayala Group. In addition, Mr. Borromeo leads Ayala Corporation's healthcare businesses. He is currently the President and Chief Executive Officer of Ayala Healthcare Holdings Incorporated, ZapFam Incorporated, FamilyDOC, and Healthway Philippines Incorporated, the Chairman of IE Medica and MedEthics, and the Vice Chairman of the Generica Group of Companies. He also sits on the board of other Ayala companies, including AC Energy International, AC Industrial Technology Holdings Incorporated, AC Ventures Holding Corporation, HCX Technology Partners Incorporated, and Ayala International Holdings Limited. Prior to joining Ayala, Mr. Borromeo was a principal at Booz & Company, a global strategy consulting firm based in San Francisco, California, USA. He obtained his Bachelor of Science degree in Management Engineering from the Ateneo de Manila University and his Master's in Business Administration with honors from the Wharton School at the University of Pennsylvania. Please welcome Mr. Paolo Maximo F. Borromeo, whose talk is entitled Corporate Best Practices in a COVID World. Paolo?
Hi, good morning, Dr. Concepcion, and thank you for having me here today. I hope you can all hear me. Okay?
Yes.
Very good. And good morning to all our colleagues at PAASE, and happy 40th anniversary, ma'am, and to all your members. Congratulations on happy 40th anniversary. I'd also want to say a special hello to Secretary Ernie Pernia. It's a pleasure, sir, to see you again. And I'm glad that Secretary ended, or one of his main themes was how private sector, how more driven into healthcare, and that's certainly a theme that we prescribe to at the Ayala Group. So maraming salamat po, Secretary Pernia, and I think this will segue neatly into the messages that Secretary Pernia mentioned. Let me start off, maybe the first slide, please. Let me start off by saying that at the Ayala Group, as Dr. Gisela said, I look over the entire portfolio as well. We invest in industries that are critical to nation building. So we are very selective about our investment program and where we decide to put capital to work. And of late, where we've been putting that capital to work is really in
Ayala Group, BPI, Manila Water, BPI. Yung speaker ngayon, yung taga Ayala Health.
Thank you, sir. And so,
IMI, Energy.
Sorry, I just hear a little bit of a little bit of feedback, Dora. Okay. So over the last few years, we've invested in infrastructure-related sectors, including the energy sector, the manufacturing sector, as well as the transportation sector. But what we're very proud of is our decision to invest in what we call social infrastructure, which is both education and healthcare. And healthcare po, that's our newest business and something that we're very proud of. If you go to the next page, please. It's something that stems all the way po to our principals. So Jaza himself has committed to supporting the healthcare sector, and really along the lines of what Secretary Pernia mentioned, that it's an industry, it's a sector that even before COVID needed massive support. No? And obviously this has become more apparent and more obvious with COVID. And kami po, patuloy lang po ang investment namin sa sector ng healthcare. In the space, we've created a small portfolio of businesses. Next page, please. Sorry, but just to say that our vision for healthcare is one that is really synergistic and integrated in terms of an ecosystem. Our view is we'd like to bring more affordable healthcare to more Filipinos and touch at least 1 out of every 5 Filipinos by 2030, using the many investments that we've made. No? Next page, please. Thank you. So just to give, I guess, the audience a little more color in terms of what we've done in healthcare over the last few years, we've invested in 4 subsectors, so to speak. No? The first one is in the pharmaceutical subsector, and our thesis here is to bring more quality, affordable medicines to more Filipinos, and hence we invested heavily in the Generica drugstore, which we've expanded to 800 stores today. And we also started investing in our own pharmaceutical importation and distribution to be able to bring in medicine to more Filipinos, hopefully in a more affordable manner. The second pillar that we invested in is our clinical network, and I'll talk more about this later. But we're proud to say that we have the largest network of primary care clinics and specialty clinics, and it's been put to good use po during the crisis. The third pillar that we're investing in is in specialty and multi-specialty hospitals. Proud to say that we're still investing and building a new hospital. It's the Ayala Cancer Hospital, the first dedicated cancer-focused center in the Philippines. And also, of course, we have a partnership with Qualimed, which is a chain of multi-specialty hospitals around the Philippines. And then finally, our fourth pillar is in the field of digital health, where we started enabling entrepreneurs and other like-minded founders to put up these startup companies. No? So for instance, we invested in MedGrocer, which is an online medicine platform. We also invested in Aid, which is a home health service app. It's almost like a Grab or an Uber for medical practitioners to be delivered to your home. And of course, we have our own initiatives. We built our own electronic medical platform called Vigos, which we now deploy to all of our clinics. So just to give a snapshot to our audience, ito po ang AC Health, and in our own little way, we're trying to do our best, to invest more in the sector, but B, to help our countrymen, especially both COVID and non-COVID patients during this crisis. What I'll do now is segue into what we've done throughout the crisis. If you can flip to the next page, please, Richmond. Throughout the crisis, actually during the crisis, we created what we called our 4T framework, and this has guided us throughout the Ayala Group in terms of taking care of our own employees as well as the communities that we serve. 4T is nothing complicated about it. I mean, everyone's been using it, but really triage, treatment, testing, and tracking. And of course, all founded on the ability to provide medical advice both to our group of companies, but as well as our other partners and our other accounts. No? I'll talk about this very quickly, but in triaging, this is where we've put to use our clinical network, and it served over 90,000 PUMs. PUMs to date and about 20,000 PUIs. I'll talk more about this in a second. But also in triaging, we created our own digital health platform. We call it Health Now. Ito po it's an all-in-one health app that allows consumers and patients to access their doctors and physicians through virtual means, through video. At the same time, order medicine, order lab services, and pretty much do anything that they can remotely. No? The second is in the field of treatment. And here, proud to say that, of course, we've leveraged our Generica network and our importation companies to be able to bring in medicine, basic medicine that's needed for the crisis, no? So vitamin C, ang mga flu shots po, lahat yan we offer now to our employees and the communities that we serve, and of course, make it available to our clinics for our fellow Filipinos. Also in treatment, I'll talk more about this later. We upgraded our Santa Rosa Hospital into a full COVID referral hospital. I'll mention that more later. No? The field of testing, I'll talk more about this later, but we invested in our own PCR labs and our own testing protocols, which has so far tested over 50,000 Ayala Group employees. And then finally, we put a lot of work into tracking and tracing and being able to monitor our data. Hopefully, I'll give a little glimpse of that to our audience over the next few slides. No? But maybe let me take one step at a time and one example at a time. Next page, please, Richmond. In the triage area, to reiterate, we've kept our FamilyDOC and our Healthway multi-specialty clinics open throughout the crisis. Actually, we only closed down one day, the first day of the lockdown, where we had to really rethink and mobilize ourselves. But we made a commitment and we had a mandate that we would keep our clinics open. And even if, of course, our employees we take care of, but they go to the clinics day in, day out and put themselves at risk to be able to cater to patients, both COVID and non-COVID patients. And as I mentioned, we've seen 20,000 PUIs no, and 90,000 PUMs. We've also used this crisis to pivot, so to speak, some of our clinics where we felt there was need. So for instance, in Healthway in Greenbelt, we converted a small portion of our Greenbelt Healthway clinic into a chemo infusion facility, recognizing that there were cancer patients that needed a place to get chemotherapy but could not go to the hospitals. No? So yun po yung mga examples on how we've kept our clinic network open. My thesis is to be able to support the hospitals as much as we can by providing extended frontline care. No? And in doing so, I think we're proud to say we've been able to meet so many patients for both their COVID-related referrals or non-COVID related care. No? Actually, on that note, maybe the next page will give our scientists some indication of the trends that we see in our clinics. I'd like to think that our clinics, because they're all over Metro Manila, they serve as a leading indicator, if you will, of cases before they are registered by the DOH or before they are confirmed as actual cases. These charts show you the number of PUIs that we see every day, every week for the last 17 weeks in our clinics. No? It cut through at the start here, but it doesn't show the significant ramp up in March. Nung March po, napakalaki nung increase na nakita namin. Syempre, it really significantly increased. And then over the weeks of April, it started to stagnate and then started to increase again. No? And the lower chart shows our normal foot traffic, just so you can see the ratio of PUIs to foot traffic. So yung foot traffic namin medyo nag-stabilize na, pero medyo tumataas pa rin yung PUI count. So we're really seeing modest increases in cases, and I think it's an indication that we need to be vigilant, and we need to be able to detect these cases early on and monitor and treat those properly. But a benefit that we have, because we have the largest clinical network in the Philippines, and of course, we're able to do a lot more data crunching with the electronic medical records that we have. I'll move on to the treatment side. Next page, please, Rich. On the treatment side, as I mentioned, medicine and vaccination programs that we offer. But more than that, proud to say, next page, please, Richmond, that we, very early in the crisis, we decided to upgrade Qualimed Sta Rosa into a COVID referral hospital. Maliit lang po, pero nakakatulong kasi there were times in the crisis, and we see it again today, where capacities are getting more and more constrained. I'm sure it was mentioned in our panel earlier as well. While we do have the beds and we're nearing 60, 70, 80% utilization of those beds across the country, our biggest bottleneck po is really in terms of the manpower. No? Many of our hospitals, including us, can convert non-COVID beds to COVID beds, but unfortunately, manpower po ang pinaka-bottleneck natin. Having said that, we're proud to say that we built this in record time. It's a 15-bed holding area, 15-bed ICU as well. Sorry, it's a 12, it's just a minor typo. It's a 12-bed holding area and 15-bed ICU. Converted 30 beds for COVID patients only. And more importantly, we built a BSL2 here too. No? I'll show you some statistics very quickly. Next page, please. As you can see, these are the capacities in the holding area, the COVID wards and the COVID ICUs. And over the last few weeks, as with every other hospital, tumataas po. No? And again, people ask me, what is that a function of? It's a function of three things. It's a function of forced GCQ. So you have more velocity of people out in the system. And it's of course, it's a function of cases also in other, not in our case, but in non-NCR areas. And then finally, it's a function of more testing. So we're finding more people today that have the virus. And of course, that leads to treatment protocols and confinement, even for moderate cases. No? But this is in line as the other trends we're seeing in our other hospitals. I'll move on to testing then, which is what I mentioned. Proud to say I thank you to Dr. Gisela and I know the scientist team that we have because early on in the crisis I asked them for advice now from the PAASE on how to go about testing. And very early on, we committed to invest in testing, first with rapid antibody tests, and then afterwards with confirmatory PCR tests. Next page, please. Over the last, actually more than 6 weeks, we've conducted rapid testing for more than 55,000 employees. No? And it's given us, of course, rich data. These are using rapid tests. Ang protocol po namin, we worked on very deliberately, very carefully, very thoroughly. We would test our employees and those who would register as positive IgM. We would test through our confirmatory PCR laboratories. I think the experience over the last few weeks has given us more comfort and more confidence that we're able to keep infection rates relatively low. Next page, please, Richmond. Sorry, maybe before I get to the data, this is just to show the network of labs that we built for PCR testing. We've contributed 5,500 tests per day to the national requirement. Proud to say that all of our Qualimed laboratories in Laguna, Batangas, Iloilo, and Bulacan are now accredited, except for Batangas, but everything is accredited. We partnered with UC Med in Cebu, donated in Davao, and of course in Makati City, we partnered with the Tropical Disease Foundation, which has been operational since May, actually. But these give us the ability to do confirmatory PCR testing. And ang nangyari po, next page, please, Richmond. Sorry, sige, next page, please. Yes, thank you. So this is some data from our program, no? That shows what the incidence levels are or the prevalence rates are for our IgM pluses. So we have about 3% infection rate, 1.5, 1.6% for IgM positive. And makikita nyo po on the lower chart how that prevalence rate has increased over time. So as GCQ became more, I guess, more the norm, we see an increase here in the red line of 2.27 and the blue line as well. Interestingly, our positivity rate from the rapid test, the confirmatory rate, is very low. No, it's only 4.26%. So throughout this process, we've been able to identify a handful of PCR confirmed patients. But that said, we've also been able to confirm other PCR patients through other means. Next page, please. Ito po, this shows the in the entire Ayala Group, we have about 100 confirmed cases so far, and we track those on an individual basis. This is the subset of that 100 and how we recorded them. Some were tracked. Actually, more than half are asymptomatic. Half of those come from the rapid testing protocol. Half of those come from what we call close contacts, meaning close contacts of symptomatics, and the rest are from symptomatics. No? And so I think it's important to note that while rapid testing gives you a level of filtering, it's also very important to be able to track symptomatics right away and to be able to track close contacts immediately and test those close contacts immediately. Kasi doon po, nakikita po namin na medyo mas mataas ang positivity rate. But just to say, I think from our group, about 100 plus cases out of 50,000 employees, we've kept it relatively low. We have had cases of, pockets of infections. Yun po ang kailangan natin bantayan lahat. No? And happy to say that, I think over time we've learned to be more efficient too. So for instance, a BPI branch that catches an infection, we've learned to rapidly test the people that are there, sanitize the branch, and be able to open up with a team, with an alternative team the next day. No? Kasi po ang pakiramdam namin sa private sector, ito na po ang new normal natin eh. No, so as long as, of course, the death rates are not spiraling out of control, as long as the hospitals are not getting overwhelmed, we will face a GCQ situation where you will have people get infected with the virus. No? And ang importante po is that we're able to detect those early and bring the business back quickly. No? Kasi po kung ma-detect natin na maaga, at least maagapan natin ang pag-spread. At saka more importantly, matutulungan natin yung pasyente to get the proper quarantine and the proper treatment protocols so that it doesn't get any worse. Next page, please. Just some data on our PCR testing. We're testing over 1,500 people in Makati and over 1,500 people in Santa Rosa. These numbers will just increase. Ito po yung sinasabi ko na tama po yung sabi ni Secretary Pernia na ang private sector contributed significantly to our lab capacity build out. And like us, we're experiencing a lot more tests. And of course, that leads to a lot more cases. A lot of these are asymptomatic cases. Meron po kami isang BPO na kliyente, may isang nag-symptomatic. In 1 week po, we were able to detect 50 employees in that BPO company who were positively confirmed. And so that adds on, of course, to our national totals. But to me, it's a good thing that we're able to test more people and that we're able to detect them sooner rather than later versus in the previous weeks and previous months where we were pretty much helpless. I hope that gives people a glimpse of the testing that we've done. Next page, please, Richmond. Maybe let me end, Doctora, with just some learnings. And yung sabi ko nga, maybe 3 things. Unang-una is how vital it is to be able to have early detection and of course to be able to administer timely response. These are key to controlling the spread. Kami po, we feel that we've been able to keep our prevalence rates low. Hard to guarantee that it will stay low forever. But at least when we do get cases, naagapan po namin na na-actionan kaagad. And more importantly, that we managed and treated these cases properly. No? Secondly, in the workplace, of course, there is no replacing social distancing, alternative deployment, safety and hygiene procedures. Lahat po yun ay absolutely essential. But nevertheless, mild outbreaks do happen. And it's very important that we remain vigilant in terms of triaging and testing because these do happen. And when they do, we need to be able to control it before it escalates. No? And then finally, of course, that an integrated care team in the corporate setting is so vital. No? And it's really a leadership position in partnership with every company's human resources department, but we've been working with many HR teams around the country, and we're so happy to say that in true partnership, we've been able to track cases and keep cases low, not just for the Ayala Group, but for all of our partners, including some of the other consortium conglomerates and some of our multinational clients. Maybe let me end with 2 pages, Dr. Gisela, a step back in terms of how we think about the crisis, our healthcare sector in general, para medyo big picture ng konti, and to reiterate what some of the messages that Secretary Pernia mentioned. Clearly, there was significant, I think, prior to the crisis, there was significant momentum already in the healthcare sector. And I wanted to make sure that people appreciated that and understood that, because that's the work that the DOH and our legislators have done before the crisis. Ito po, yung mga universal healthcare bill, yung cancer bill. Unfortunately, medyo naudlot because of the crisis, but we're hoping that momentum picks back up. That said, it is quite obvious that the pandemic has shown us the inadequacy of our healthcare system still, especially in dealing with the crisis. Insufficiency of facilities, whether it's inpatient ICU beds, laboratories, yun po, naalala po natin, RITM lang ang laboratorio dati. But there's also a lack of manpower, which is still glaring until today. And unfortunately, all of those lack of facilities and manpower is also not distributed geographically, at least equally. There also is a need for better coordination between and amongst the public and the private sector. Secretary Pernia alluded to that. And a lack of data capture and analytics, and ideally interoperable technology requirements. Nevertheless, ma'am, I'd like to emphasize that what we've learned throughout the crisis is, sabi nga ni Secretary, bayanihan po. Everyone is coming together. We're adjusting, we're adapting as needed. Been a fantastic collaboration actually with the public sector, with the DOH, the IATF, Project T3, headed by Secretary Charlie Galvez and Secretary Vince Dizon po. We've really rallied together both as a private sector and a public sector, and lahat na po ng sectors na nakipagtulong-tulong po, especially sa pag-upgrade ng ating testing. But I guess the 4th bullet here, ma'am, and I'd like to emphasize this for our audience because this is what Secretary Pernia also alluded to. Napaka-importante po ng healthcare as a sector in terms of nation building. And if that's not obvious to people today, I hope it is moving forward. And kami po sa Ayala, it's renewed our efforts and our own commitment to the sector. And as Jaza had mentioned, it's an industry that we will continue to invest in through the crisis and hopefully post the crisis. Kung meron pong post the crisis. But throughout the crisis, we're investing heavily in the sector. I'll end with our vision for the healthcare sector for the future, Doctora. Next page, please, Rich. Given everything that we've gone through, everything that we're going through today, we strongly believe that the healthcare sector will face massive disruption and massive consolidation. But most importantly, we'll need massive investment. And kami po, we're committed to investing in the sector moving forward. We think there are significant capacity and capability building requirements across the sector. So both in hard infrastructure and soft infrastructure. We're seeing a lot of already today organic and inorganic opportunities po, and we feel there are opportunities for partnership and consolidation within healthcare. But most importantly, our thesis is more than ever, the healthcare industry of the future will require large, integrated, synergistic ecosystems. And by doing so, we would be able to bring more affordable medicine, more affordable services to millions of Filipinos na nangangailangan po. Our thesis for the future is 4 things. 1, the emergence of distributed clinical networks for even broader reach, deeper reach to communities, families, and employees, giving care where care is needed and where patients need them. So ito po, tutuloy po namin ang FamilyDOC, ang Healthway, at ang pagbubukas po ng mga clinics na mas malapit sa mga tao, kung saan sila nakatira, kung saan tayo kinakailangan. Secondly, investing in hospitals. We need large-scale specialty hospitals. So for instance, our cancer hospital that we're building. At the same time, smaller multi-specialty hospitals in tier 2 cities, such as what we have in Qualimed. And we'll look to build more of those moving forward. Number 3 po, napaka-importante, affordable diagnostics, affordable medicines for even more Filipinos. And our commitment is to build generica even more, build lab services and other diagnostic products and services even more. And then finally, napakalaking opportunity po ng digital health. At saka I'm sure Chris and some of the other scientists here in the data field will appreciate that there is huge potential in data analytics in the healthcare sector. And the opportunity to tie all of these together with electronic medical records, patient data, that then gives us better insight into population healthcare, barangay trends, which will help not just in this crisis, but in future pandemics and in controlling chronic conditions, whether it's diabetes or hypertension. So yun po, I'd like to end by saying thank you very much to PAASE for inviting me. Happy anniversary to the group. And rest assured that the private sector is committed to the healthcare industry, and we at Ayala are one with the government and one with the academe and the scientific community in trying to beat this virus and hopefully overcome. Yeah, maraming salamat po.
Thank you, Paolo, for sharing with us your vision, your thesis, like a true academic, Paolo. Your wish list, lots of valuable insights and lessons from Paolo from the private sector that academia can learn from. Thanks for sharing with us the 40 integrated strategies and initiatives that the Ayala Group has undertaken to cope with the challenges posed by COVID-19. Also, the infrastructure and manpower you built. So for data analytics, I understand Reyna is with you, Paolo. Is that right? Yes. And this bring a great number of your employees back to the workforce, keep the prevalence of COVID-19 low, also to help your surrounding communities. I also noted that you're continuing to take care of other illnesses like cancer, because cancer, diabetes patients, and other infectious disease patients are somewhat neglected during this time of COVID. I would like to note the significant amount of investment you're making to protect your employees, which should make you the model and leader for the rest of the business sector to follow. Thank you, Paolo. Ladies and gentlemen, let's give Paolo a rousing virtual round of applause. I understand, Paolo, you are ready to leave for the hospital in Batangas that you visited. But if there are any questions from the audience at this point, maybe it is important for us to ask the questions now. Any questions from the audience, because Paolo might leave, whereas the panel, Dr. Pernia, and the rest of us can stay. Okay, here are some comments from Des Hotea. Great work of the Ayala Group, great presentation, Paolo. Lots of lessons learned, which could be emulated by other sectors. Let me tell you, Paolo, that Des Hotea and others from UP Los Baños have had their COVID testing center certified by the DOH.
That's right.
And remember that we were offering that your people could be tested. They could be trained in UP Los Baños, okay, for testing. So this is now operational. Okay, so the comment, Rodel Subade, What are your plans for expansion of services for our COVID patients outside Ayala to respond to the ongoing spikes in confirmed cases? This can be a good model for other companies. What are your plans for sharing this with other companies? Is there any? Maybe DTI can team up for this co-learning.
Yes, po. We've been working closely with the DOH. In fact, Secretary Duke is visiting Qualimed next week, and also in touch with the DTI. And we've been very open po with our industry associations in terms of sharing the learnings that we have been having, and we have been learning over the last few weeks. And we're happy to continue providing information. In fact, we work with a lot of other companies today, both large conglomerates, multinationals, pati pong SMEs. We've offered our testing services to SMEs and our advice to SMEs.
Okay. So in another company, seemed to result in increase in number of COVID-19 cases. There are many possible reasons: psychology, false security, more complacent to net increase in external community, hence more cases. Any perspective? Do you do longitudinal testing?
Yes, we do, Chris. We do longitudinal testing because we test people on a weekly or an every other week basis. Siguro kami, well, I'm sure there's some false security there, but we really made it a point to say testing does not make one invincible. And it does not replace the basic hygiene and social distancing protocols. So we kept that spirit high across the Ayala Group and for many of our clients. That said, I do think that more testing undoubtedly leads to more cases. And that's just the nature of it. But beyond that, there are cases where you do have mini outbreaks. And those are the situations that you want to be hopefully get under control sooner rather than later.
Okay, there's another question here, or comment. I would like to see how the Ayala model can inform the opening of classes. It's a little tough, but
yeah, it's mahirap po. We're actually monitoring the data as we speak. Like I said, this recent increase in cases is worrying many people, rightfully so. I think what we have to see is what is the trend moving forward. Will it continue to spike and at exponential levels, in which case it will overwhelm our capacity? I tend to look at three things from a data perspective because I'm sure people can get very overwhelmed. One is I've focused more on the death rates rather than the case rates per se, but to make sure that our death rates are controllable, because at the end of the day, we need to make sure that we're protecting our people. The second is the severity rates. So how bad are the cases that are being registered? And right now, thankfully, it's fairly low. And then the third is, of course, the supply rate. So meaning the occupancy levels at our hospitals. Because if your death rates are going up, if your severity rates are going up, and your hospital capacities are getting used up, those three things are ripe for disaster po. So yun po ang binabantayan namin.
okay, thank you, Paolo. I think Des Sotea is very enthusiastic about pursuing collaboration with the Ayala Group. So
Yes.
you might consider, yes, getting more people trained for testing in UP Los Baños.
Yes. No, please. Actually, if I could also challenge the PAASE, this is really our biggest challenge as a sector. We can spend money to build beds and to build more ICUs and bring in more ventilators. But it's not as easy to just put in money and expect that you get tens, hundreds of doctors and nurses immediately. And so, of course, digital helps, but nothing replaces priority in terms of training, incentives in terms of learning for our students and soon to be medical practitioners. Napaka-importante po nun.
Okay. So I'm sorry, we will have to soon end the Q&A here, Paolo and everyone. Hey, there's an off-tangent question here. Off-tangent. Would Ayala be interested in investing in UP Diliman, Philippine General Hospital that is being planned?
You know, I'm of course close to Dr. Legaspi, and if there are opportunities for public-private partnership, we'd be happy to explore those. I know they're also looking at public-private partnerships in PGH for the cancer wing, and we'd be more than happy to look at those. I mean, UP-PGH is a fantastic institution, and obviously we're honored. We'd be honored to work with our colleagues from the UP-PGH.
I think that's important because what the UP Manila PGH would have would be the specialists, the manpower. It is the most critical part of any development. So thank you very much again, Paolo. And I think we learned a lot from your talk. And I think it substantiates what Secretary Ernie wanted to put across to all of us, that there should be trustful, synergistic, private-public partnerships. Okay.